Hi, it's Dr. Eve and welcome back to my YouTube channel. So, we have all been there. You wake up in the morning and you go to the mirror to look at your reflection and you find some new friends you were not expecting that have seemingly appeared overnight. This is obviously the most annoying thing to ever happen, and it can be so frustrating and stressful. And normally the immediate response is to pop that spot. No, don't do it, sis. The reason for this is that it can actually be quite damaging to the skin and it can irritate and cause more problems. So let's have a good approach to managing that acne and how we can improve it and stop popping those spots. So, acne is something that most people experience in their life. In fact, 80% of 11 to 30-year-olds will at some point have acne, and this is something that we commonly see in general practice, and often a reason why patients are referred on to dermatology. So sadly, unfortunately, in general practice, it can also be a cause of patient dissatisfaction and the patients to feel like they are not getting heard or getting the right treatment. And this is usually sometimes a combination of things like inadequate management and also unmet expectations of what the treatments that we offer can do. So it's certainly something that I like to spend a lot of time on, giving tailored treatment to my patients. The other thing to be really clear about is that sometimes this can affect the way people actually see themselves and the way that people see them. So it cannot be negated the impacts that this has on people's mental health and their self-esteem. So we certainly have to be very, very sensitive in approaching it and also trying to find solutions for that patient in front of us. So I think it's really important that we understand that this is not just a disease of adolescents, and actually adults suffer with it too. And we need to really understand how we can manage this problem, but also what causes it before we talk about how to tackle it. So let's delve deeper. Acne is a complex interplay of many different factors. Androgen hypersensitivity, which means the impact of hormones on the skin, increased sebum production, that makes you quite oily and oil producing, bacterial colonization, and something called ductal hypercornification, which essentially is what you see as white and blackheads. This is something that can also cause occlusion of the skin, and inflammatory mediators also perpetuate and worsen acne. It's usually a condition which is a problem of the hair follicle, also known as the pilosebaceous unit. The main cause is a bacteria called Cutibacterium acnes, also known as C. acnes or previously known as P. acnes. So just understanding some of the science behind it helps us be able to tackle acne and give various different types of management to do so. So when we normally see acne, we normally examine the skin and look for a series of things like whiteheads and blackheads. Blackheads are the things that we see, and these are types of comedones, which are essentially dirt and debris stuck under the skin which become oxidized when they approach the surface of the skin. And these are just what we see as blackheads. Whiteheads are essentially the same thing but trapped under the skin, in which you can see the white debris stuck underneath the skin. So this is just usually a disorder of the pilosebaceous unit in the hair follicle, which causes the acne to be produced. Inflammatory acne is essentially the same thing, but it's caused by inflammation in response to the debris inside that pilosebaceous unit, and then causes an overgrowth of bacteria, which then causes the spot or that unit to look very red and inflamed. This can be in the form of a papule, which is essentially an inflamed or red spot, or a pustule, which is the same thing but with pus. So we often look for a combination of these in patients, and common places are on the cheeks, forehead, and in the chin, in the T-zone area. But certainly it can be much more than that, including the body. There is a very severe form of acne which causes inflammation and rupturing outside of the unit into the surrounding skin, and then causes the skin to be much more inflamed and pussy and swelling. And this is something we call nodular cystic acne. Acne which is left unchecked can lead to irreversible changes such as scarring, and the importance of dealing with this early cannot be understated. so the patient doesn't have to deal with the consequences of acne, rather than just treating it when it was a minor problem. So, how can we treat it? First things first, we have to build an effective skincare routine which the patient can follow and they are consistent with. Consistency is really key. This can be done using various methods, including over-the-counter remedies, which you can buy in any shop, supermarket, or shop on the high street. So it's very important to say that this cannot just be the mainstay of how you manage acne, especially if it's much more severe. Often prescription treatment is required. But if you are going to go to the shops, what do you need to look for? Well, a basic skincare routine needs to include a good cleanser. It's something you can use both morning and evening, which doesn't need to cost the earth, but does need to be able to clean the skin effectively, and that does not mean wipes. So you have to be able to use a cleanser. Something like a foaming cleanser can be quite good, but if you have kind of dry skin, a hydrating cleanser may be better for you. Next, you will need a good antioxidant. So something like vitamin C, which helps to address the free radicals and the things that cause irritation to the skin. But remember, not all vitamin C is the same. Additionally, you need a great moisturizer. So a moisturizer which can help repair the skin and improve the skin barrier. Again, it doesn't need to cost the earth. Looking for products which are non-comedogenic, which don't cause acne, essentially, and have actives in your products such as things like niacinamide, benzoyl peroxide, salicylic acid, azelaic acid, or even retinol, although that might not be for everyone, is a great place to start in order to improve your acne and also to give you the results that you're looking for. But the most important of all of these things are sunscreen. If you're going to be serious about your skin, you need to be serious about protecting it too. Sunscreen is important for all skin types, no matter what your hue. So all skin needs sunscreen. Finally, it's really, really important to be able to approach your doctor when you realise that you haven't been able to manage it yourself. So let's talk about prescription skincare. I often see patients who come into clinic and say, I've tried everything. And then I look at their notes and realise they've never seen a doctor before. So have you really tried everything? That's understandable. So prescription skincare can actually be really helpful to be able to manage your acne and can give you the long-lasting and definite results that you're looking for. So when we talk about acne, I often tend to assess the patient in front of me and look at the distribution of their acne. Is it just on their face, or do they have involvement in other places, such as their back or their shoulders, or even other parts of the body? So I would normally address it by approaching it either topically, systemically, or a combination of both. So some topical things include creams, gels, and lotions, and they can be really useful for treating areas that you can reach really well, such as your face and neck, for example. But there are some great examples which you can get over the counter or on prescriptions, such as things like Epiduo, Duac, and Zinniet for your body. These should really only be after consultation with a doctor though, rather than just kind of hopping on the latest trend. Systemic treatments are really useful for acne, which is much more widespread, involves areas such as the back, shoulders, face, all at the same time. And usually this amount of acne normally requires systemic treatment to be able to give the definite results that we need to do, and also to give complete clearance to the skin. It's important to know that this normally takes a while and you can be expected to see results in about 8 weeks, but you will need to stay on treatment for a few months to get the benefit. I also love giving a combination of treatments to patients that have systemic acne, so that might involve oral antibiotics, hormonal treatments, topical treatments at the same time, and in specialist cases we also talk about things like non-hormonal treatments. Now please bear in mind your GP may not be able to start this for you, and often you will be referred to us in dermatology to start this as well. So options include things like spironolactone and trimethoprim, but there are other prescription treatments which I'll go on to talk about a bit later. Finally, I find it really important to set expectations. Let's be real about what we can achieve and what we can't achieve within a setting. So within a general practice setting that I sometimes sit in, I find that it's important for my patients to know that we can't go beyond certain barriers, and we need to see you in a different setting to talk about other types of treatment. And also, I don't want to sell you dreams, I don't want to lie to you or give you promises that can't be delivered. So if you understand what we can achieve, then we can work well together. Outside the NHS and within general practice settings, this is within the UK, there are certain other things that I would find really helpful to managing acne, such as cosmetic treatments like things can manage your acne and also the consequences of acne, such as scarring and hyperpigmentation. So some of my favourite treatments are things like chemical peels, which can be used at varying depths, utilising active ingredients to be able to give really good results, which can be continued. But normally this is a not one and done treatment. You need to continue going back to get the results that you're looking for. They can be helpful in improving the hyperpigmentation, skin texture, and actually treating your acne. Additional things like microneedling are perfect in addressing the scarring that can be left behind from acne, and can also be really good in improving the texture as well, and pigmentation additionally too. Again, this is something that needs to be done regularly. And finally, things like laser and light therapy are wonderful in managing acne, particularly a type of light therapy called intense pulse light. That's something I'm going to talk about in another video. Such treatments really need to be done by qualified and experienced professionals that have an in-depth understanding and knowledge of skin, and also of the different types of skin treatments available to you and addressing your skin type. There is no one-size-all method of treating skin, because if there was, everybody would be doing it. So it really needs to be an individualized approach, and that's something I really pride myself in doing in clinical practice as well as in private practice. In recent years, I have noticed a number of patients who are armed with knowledge. They know about skin. They come in having said they've done this, they have this skincare routine, they have these skincare products, but they're still not seeing results. So they want Roaccutane. Roaccutane, Roaccutane, Roaccutane. I love it, but it's something that you need to know that is not for everyone. So in the age of social media, where everybody's doing something or trying something or having something, it can be a wonderful opportunity to learn, but know that it's not for every person. Not every treatment will always suit you. So you certainly need to have really good discussions with your GP, who would probably refer you on to dermatology to consider Roaccutane, but we would normally make an assessment about whether or not that would be good for you in combination with looking and reviewing your medical records. So if you're interested in things like having oral systemic treatment like Roaccutane, then we would require you to have routine blood tests, and also in the case of women, you would need to be on contraceptive and have regular pregnancy tests to ensure that you're not pregnant while you're on treatment. Additionally, there are other things that we would need to be sure about. Do you have any pre-existing conditions which would make you ineligible to have it? Are there any mental health conditions that would be of concern to us if you're on that medication? And also, it may just not be right for you at this time, and you may not have tried anything else. So don't be discouraged if your doctor sees you and says it's not for you at the moment. It's certainly something we can review and decide. Now, why is sometimes Roaccutane not the best treatment for you? It has to be said, sometimes Roaccutane it often causes side effects which can be difficult for some people to handle. So some people do experience quite severe changes in their mood with it, and that's the reason why we're quite keen on knowing about any mental health history or reporting any change in their mood while they're on treatment. Skin dryness, tightness is certainly a feature of treatment with Roaccutane or its similar medications, which are in the form of creams, and that's due to the turnover of skin. Often some people find that their skin is quite sensitive, and this is the reason why it's really important that you follow our advice, and we give you some tips and tricks about how to manage that, and also wearing sunscreen. It's certainly a treatment that can have massive implications on improving skin all over, and this can be lifelong, and that's the reason why most people are quite interested in it. But it's certainly something that we would have to have individual consultations with you over to decide whether or not it would be right for you. So having spoken to you about all of the treatments that we normally would approach in clinical practice, is there any of these treatments you've never heard of before, or have you had difficulty getting hold of them? I want you to understand that in the UK, certainly something can only be consulted with a doctor, and we would not recommend that you purchase things online without speaking to your doctor first, because it can have implications on your other medical problems, as well as we need to know what you're on in order to help you best. I want to thank you so much for listening today, and I look forward to hearing your comments in chat below. Have a good day.